Hi there, my name is Richard. One day I noticed my left shoulder was turning blue during a bodybuilding type workout, and this progressed over the next 2 months into swelling of the arm that would remain for about a day after the workout. And I was lean, so I was used to seeing veins, but they were much more swollen and protruding on the left shoulder. Then I started to notice progressively less mobility and strength in that left shoulder, and this bothered me for years. I noticed veins in the left chest and somewhat severe swollen protruding veins in the left shoulder, while the whole side was discolored. The tests that I get, originally started to think there was a blood clot, so I went to urgent care, and I remember being told that the doctor wasn't worried about it. So after that, went to my primary care doctor, who told me it was normal and that I would be better in time with a physical therapist who he referred me to. After seeing the therapist, he told me that he'd never seen anything like it and can't help me. So I needed to know what was wrong, and no one seemed to know. I then had a diagnostic ultrasound with no results and an MRI with no results. A second MRI showed 50% reduced blood flow through the left side, after which doctors made an appointment to see a vascular surgeon specialist. The vascular surgeon then diagnosed me with thoracic outlet syndrome and recommended I had invasive surgery to cut out my first rib and muscles on the side of my neck called the scalenes. The medical term for this is a first rib resection. I wasn't satisfied with how I was examined, and no one seemed to know for sure the symptoms. I knew they were getting worse, and instead of getting the surgery, I did some research on my own and purchased Dr. Stoxen's book, The Human Spring Approach to Thoracic Outlet Syndrome. In the book, it teaches you the shoulder, neck, and chest is designed to work as a spring mechanism. For instance, when football players tackle, they lead with the shoulder, and the impact is taken up by the shoulder like a spring on a bumper of a car. It made sense. It also said muscles have 3 degrees of tone. Normal tone, this is the tension a normal person would have, and the thoracic outlet is wide open, allowing safe passage of the blood vessels and nerves. Hypertone, which is contracting when it shouldn't be, squeezing down on the thoracic outlet, causing compression of the nerves, artery, and vein. No tone. Then there is no tone. Paralyzed or no existing working muscle. Since it appeared my vein was narrowed, causing the blood clot to back up and swell, I had hypertone muscles and had to do deep tissue to normalize the tone. I learned that if I do the deep tissue points on the 10 muscles that control the tension of my thoracic outlet, I could reverse the thoracic outlet on my own. So, me and my girlfriend spent months and did the deep tissue on the muscles to change the hypertone to normal tone. It did help, but I still had the protruding veins in my chest and shoulder. And also, my arm and shoulder just didn't feel right. I didn't know why my veins still protruded, because it seemed like I had done a good job releasing the muscle around the thoracic outlet. However, I was stretching my chest, neck, shoulder, and arm muscles every day. I decided to go see Dr. Stoxen and get his opinion. I made the trip to Chicago. Dr. Stoxen recommended I come the night before my appointment so he could do an examination. It would know exactly what was wrong, how to reverse it, and how long it would take. The examination took a fairly long time because he went through my muscles meticulously, checking each one. He did orthopedic tests, nerve tests, and told me I had a rare form of thoracic outlet syndrome. While I was lying on my back, put his thumb on top of my front shoulder and pressed down gently. This is when I felt my shoulder bone slip at least 1.5 inches down into the shoulder socket. My shoulder was dislocated forward and came down into the thoracic outlet where it was in contact veins passing through my thoracic outlet tunnel. He said I had genetically loose packed joints, and I was overstretching these already genetically loose joints, thinking I was stretching the muscle. He explained that stretching the chest, shoulder, and especially the neck oftentimes will make a thoracic outlet syndrome worse. And the muscles are tight compressing the outlet because they are short, and they are contracting because they are soaking in inflammation. The nerves detect this inflammation and notify the brain there is an injury there. The brain responds by contracting the muscles around the thoracic outlet, and that is what causes the compression. The key is to do vibration massage and deep tissue to flush out the inflammation and break the circuit so the brain will no longer trigger the muscle contraction and the outlet will open up. Apparently, I was doing a great job of treating myself, but he figured the stretching stretched out the fibrous capsule that keeps my shoulder from dislocating, and it dislocated. He said out of thousands of patients with shoulder issues and thoracic outlet syndrome, there were only 3 cases like mine where the reason the veins were blocked was because the shoulder was dislocated down into the outlet where it didn't belong. What's crazy is the other 2 people who also had no idea their shoulder was dislocated, as did I. They also had a bad habit of constantly overstretching their neck and shoulder, which led to the hypermobile movement in the shoulder called hyperabduction syndrome as the cause of the compression in the veins. He did full days of deep tissue treatment on the contracted muscles, mostly around my dislocated shoulder and arm, and reset my shoulder back a number of times. Each time that it did that, it shifted less and less distance. He gave me specific instructions to stop stretching my neck and shoulder because it was already overstretched. Then he instructed me how to lift weights within a strict range of motion to reset the muscle tone so it would stabilize my shoulder in the socket. I'm working on strengthening my shoulder muscles and treating them with the vibe massage he invented. I guarantee with how complicated my case, it's no wonder the other doctors weren't able to determine what was wrong with me. Dr. Stoxen said if I would have gotten the muscles cut out of my neck and the rib removed like the vascular surgeon was planning, it would have destabilized my neck, shoulder, and thoracic outlet even more. I'm so glad I didn't get the surgery and am working out regularly with the exercises Dr. Stoxen has recommended and checking in with him regularly with my progress, and optimistic that I'm on the right path to getting better.